Hello everyone, myself Dr. Amit and I am GR in the Department of Radiodiagnosis at AIIMS Hyderabad. Today I will going to present one clinical case. One patient came to surgery OPD with complaints of swelling in right leg thigh region since 1 year. So this is the swelling cause. So swelling it is hard in consistency and swelling was not mobile. Then patient refers to the radiodiagnosis department for further investigation. Then we did USG and these are the USG findings. So look over here. So here we have well-defined irregular hypoechoic lesion with lobulated margins. Okay, so these are the margins seen in the medial aspect of the right thigh, approximately measuring about 4.1 to 4.2 centimeter in subcutaneous plane. And look over here we can see the posterior acoustic enhancement, and on color Doppler there was moderate internal vascularity, and on power Doppler there is high resistance waveform as well as low resistance waveform. So look over here the resistive index is 0.4. So our impression was a well-defined irregular hypoechoic lesion with lobulated margins with moderate internal vascularity in the subcutaneous plane, suggestive of soft tissue tumor. And our differentials was fibrosarcoma, leiomyoma and angiomyxomas. Patient did MRI outside and we just got 3 sequences: T2, STIR and T1. So look over here, this is the coronal section of T2 sequence, and here we can see that a well-defined irregular encapsulated soft tissue mass measuring approximately around 4.5 into 4.2 into 4.8 centimeters centered in subcutaneous layer and protruding over the skin in anteromedial aspect of right distal thigh with no invasion into the deep fascia. That is, we are consistent with our sonological finding, that is this soft tissue lesion is in the subcutaneous plane only. So we can see that this lesion is hyper intense on T2 weighted images. Now look over here, these are the axial section and these are STIR sequences. Here we can see that lesion is hyper intense. Now this is the T1 weighted image, and in a coronal plane here lesion eliciting isointense signal to the muscle. We don't received the diffusion weighted images. That's why we can't comment on whether the soft tissue neoplasm is malignant or benign. So our differential was it can be soft tissue neoplasm. Cytology report turns out to be feature suggestive of myxoid mesenchymal neoplasm. So that was our case. Now let's talk about the literature review on it. Myxoid tumors of soft tissue are characterized by their mucoid or myxoid extracellular matrix, which results in distinctive cross-sectional imaging features. Because of high water content, myxoid lesions tends to resemble fluid with high signal intensity at T2 weighted images. Low attenuation values at CT and hypoechoic to anechoic appearance at ultrasonography. Myxoid soft tissue neoplasm include heterogeneous group of benign, locally aggressive and malignant lesions, and they commonly affect the extremities and spare the visceral organs. There is considerable overlap in the clinical and pathological features of these tumors, making definitive diagnosis challenging. Myxomas are generally well-defined and intramuscular with hold or lacy internal enhancement and may show perirenal non-enhancing edema or fat read. Myxoid soft tissue tumors are diversified group of tumors of mesenchymal origin. Myxofibrosarcoma may have infiltrating margins with an irregular enhancing tail. Myxoinflammatory fibroblastic sarcomas is usually acral in distribution, whereas the presence of fat and ossification is suggestive of myxoid liposarcoma and ossifying fibromyxoid tumor, respectively. Depending on the entity, most patients will present with a lump or other painless soft tissue mass somewhere in their extremities or trunk, or they are entirely asymptomatic. Some tumors are extraskeletal myxoid chondrosarcomas or aggressive angiomyxomas can cause pain. Treatment and prognosis. It will entirely depends on the underlying tumor. Malignant tumors and locally aggressive tumors are the intramuscular myxomas, and aggressive angiomyxomas will mostly be excised with margins, and again depending on the respective lesions might require further adjuvant or neoadjuvant chemotherapy or chemoradiation. For most other benign tumors, therapy will depends on symptoms. So this is all about the clinical case, and these are my references. Thanks for watching this video and stay tuned for the next one.